117 million of the world's population has been affected by the COVID-19 virus. One thing we don't know is how many chronic pain sufferers have been affected by the coronavirus, whether it's by contracting the virus, which may exacerbate their symptoms, treatments and doctor's appointments have been limited, or they have to reassess what type of community assistance they will allow in their homes due to the high number of cases and fear that is coming out of this pandemic. In today's show, we're talking COVID-19 and chronic pain. And of course, we're getting into the question of the week. As a chronic pain conqueror, are you getting the vaccination? Are you ready for another chronic pain conversations? Let's go. Hello, and welcome to Chronic Pain Conversations. My name is Kalila Bruswell, the Overcomer, and this is my beautiful and wonderful host, Sharifa McLaren. This is a show where we have open and honest dialogue about chronic pain. We share our experiences, acknowledge the wide variety of chronic pain diagnoses, and look into ways to manage chronic pain. Okay. So we've been off for a week. So today we're going to start off with pain or pleasure. We're going to jump right into how our bodies are feeling and how it's affecting this show. So, Sharifa, tell me, pain or pleasure, my love?
I want to say for the most part, I am all pleasure today. We had a break, so that was really needed. Little here and there things that come up, but for the most part, forget the pain. I'm all pleasure today. Kalila, how about you? I have a feeling I know what you're going to say.
What am I going to say?
You pleasure at this point.
Why am I pleasure?
Because soon enough, you are going into some sunshine. Like when I say soon enough, I mean like right after the show. I'm going back to Cali. And at this point, she could have probably done the show in Cali, but she was like, let me just,
But here's the thing. Yeah. That is not the only reason why I am in pleasure.
Okay.
I got my nerve block injections yesterday.
Oh my God.
Last night, Sharifa.
And how perfect. You get it? Only to go into nice weather where it's like nothing to stop it from working.
Girl, I had to put my clinical team and set everything up. I got my massages, I got my chiro, I got my nerve block injections. I got them all lined up so that I can quarantine when I get to California and then go back into my 2 weeks of clinicians. So,
perfect.
Pleasure today, guys. See the smile? Yeah, let's go. Are you ready for today? Because I'm so excited.
I am excited, and I think it's a conversation that it's just got to be had.
It has to be.
Let's just have it.
Okay, let's go.
Okay, so pertaining to COVID-19, today's all about COVID-19. What is your personal perspective about COVID-19? So, do you think it's good? Do you think it's bad? Do you get nervous? Has it made you anxious? What are your personal thoughts and perspective pertaining to it?
Okay. Well, first and foremost, it's not a good thing. Let's really be. People are losing their lives. Yeah. There's chaos. There's confusion. There's fear. There's a lot of unanswers. It's not. Those aren't good things. However, it has brought families closer. It has given understanding. Things like depression, mental health, family violence has definitely been topics that were always pushed under the rug, and they've definitely come out. For me, at the beginning of the pandemic, even though I dealt with a lot of things because of COVID, and we're going to get into that for today's show, it did cause me to have to restructure my life and to refocus and to do things that I wasn't doing before. And it gave me a ability to shift energy into places that they weren't before. So it ended up kind of being a good thing for me, but then it ended up being a bad thing for me after my most recent accident. So, but what about you? Tell me, my love.
I agree 100%. Totally a bad thing. I do want to say that me personally, it has brought me closer to my family. That space of us having to stay together. We're no longer going out and doing our own thing throughout the day and then coming home. It's like we wake up together, we go to sleep together. Everything in between is just together. And so we find time to, have conversations, watch things together, do things together. Me and my mom picked up doing puzzles together. Like we've bought 500 pieces and have been putting those together as a bonding experience. We talk, all that stuff.
Your mommy's little girl again.
Right? But I also think personally, a good thing about it that I think we should have been doing before, but now it's more stressed to do it, is the little things that we should have been doing. Always washing your hands. Always, listen. Example being, how many times before COVID have we went to the grocery store and took up a cart, pushed the cart like it was nothing? Now we go there, everyone's wiping down carts, got gloves on to touch cart. Think about it. Well, I think
we're Indian, so I'm not saying a word about this.
I think in some ways it is it's a good thing where it teaches us certain things and giving us habits that with or without COVID we should be doing, but I'm ready for it to be over.
Girl, I was ready for the flu to be over from the time I was born. So. Okay. So let me ask you a question.
Yeah.
Have you had to turn to people for support during this time that you didn't have to go to support for, or have things had to change?
I have.
Okay.
So me personally, I get stressed out easy, and so with stress, my mental health can sometimes be whack. I get depressed, I shut down, all that stuff. And it's so funny. The other day, my husband was feeling like that. So instead of him having to comfort me and talk me out of my little funk, I was now in that position where I had to be talking somebody out of their little funk. So the tables have definitely turned when it comes to certain things. I feel like with me knowing what it's like to be home, all the time, has also helped to kind of talk. So I hear people say, I can't go out, I can't do this. I said, well, I give them examples of when I was sick and couldn't go anywhere.
Yeah.
So the tables in some cases have definitely turned.
It's really funny that you say that because I'm gonna get in so much trouble for this.
Oh my God.
I have become free because of COVID. Like with everybody in-house, I can now explore the world, social distancing from everybody, go at a slow pace because we move slower.
Right.
I can visit places because nobody's there anymore. No. And so it's just been really funny because I actually feel like I've gained back part of my life because of this. So it's kind of like the introverts have become the extroverts and things like that. But I've also had to definitely get a change in support. We'll get into it, but because one of the biggest things were the healthcare workers, and like I had a PSW that was coming in and helping me at the beginning of COVID, and I had to cancel it because the numbers were so high up, and they were, if you have somebody that's going into different places and they're going into 10 different houses or 5 different houses in one day, it's up in the ante. And so I was like, I don't have time for that. Not with my health. And so, family and friends had to step in when we took certain resources out.
Yeah.
Right.
Yeah.
And so that's been definitely a thing. But you really touched on something interesting in terms of being able to support family or people that you know during this time.
Mm-hmm.
I don't know if you remember, but at the beginning of this whole pandemic, a lot of chronic pain sufferers, fibromyalgia fighters, they were like, well, now you know what it feels like to be isolated. Now you know what it feels like to go through depression. And that was actually really hard for me because I felt like there should be more empathy coming from the chronic pain community instead of in your face, or at least that's my thought and my perspective.
Yeah.
But, it was really funny because a lot of people were connecting with me going, are you okay? So nobody said, are you okay after my accident? But when the pandemic happened, everyone was like, are you okay? And I was like,
yeah,
I had 3 years practice. I know how to do this.
Exactly. I actually got those same remarks and I'm like, I'm fine. Are you okay? Because I know this life. I know this life. Are you okay?
Are you okay?
I'm going to be totally honest and transparent. I was one of those people that when I heard them say, oh my God, I'm home, I was one of those people like, now you know what it feels like.
Oh,
I'm not going to lie, but I am going to say it should have been more empathy. You're definitely right, because not everyone put in that situation can handle it.
No.
Because I know where my mind was at the beginning of my personal journey, and it was not great.
It wasn't great.
It was not great.
It was really depressive. And I think what's hard for me is like, we wanted people to understand us and to support us during that hard time where they were looking at us and they were like, why are you depressed? Why are you? And it was a place where it was really hard. And I don't know what it was, but I mean, I occasionally made the joke about, oh, now you have a dose of what my life is like, but I never really tried to throw it in their face because I know that depression, I know that confinement. You have freedom, and then someone's putting you in a box, and
you don't have a choice but to stay in that box,
and it kills you. Right. I think the other thing that was really hard was, there is the stay at home. Everyone's like, stay at home, but then they're also saying social distance yourself. And so I found a way how to social distance myself and still live my life and still be in COVID and still be happy. And so some people just went, okay, put me in the cage. And it was hard. It's really hard.
And I think at the beginning too, with social distancing, it was confusing.
Yeah.
I say confusing because real quick, at the beginning, my husband was still working. So when they said social distance, he was in this mindset like, I can't take a chance of getting you sick. So does that mean we don't sleep in the same bed? We don't share the same room? It was just out of his concern for me.
We're wed and we have to have the conversation if we can share the same bed.
I mean, no, but I think it was just the main fact of this was so new to everybody.
Wow.
We were still going around, people working to make that paper, but didn't want to be a risk to me as well because of how detrimental it would be to me. So I think it was just mainly out of concern. All of those things were going through his head and going on. So I believe that it still is, but it was very, very confusing at the beginning for people.
It is. So, okay. So we've been touching a little bit about our lives, but tell me a little bit more about, your story, like the year and a half, what's been going on? Like what's been going on with your treatments? What's been going on with,
So, okay, this is actually quite funny.
Okay.
When I do dialysis 3 times a week. At this point, everyone knows. And so when they clean your dialysis site to hook you onto the machine, you put your mask on or whatever the case is, just so, germs, infection or whatever. Once that's done, you're hooked up, you can take it off, do whatever. I can't even tell you the date, but all I remember is one morning, I'm like, okay, something different. They're checking your temperatures. Maybe this is just for a few weeks until whatever. They told you, okay, like you're going to have to keep your mask on throughout the whole treatment. You can't take it off until you like leave out the building. Then whatever you do is your business. And I'm like, all right, few weeks. We are now a year in. and this is every day. And to be honest with you, I think this is gonna be like forever almost until people are vaccinated or something.
So I know talk is it's going to be here at least till 2020, 2022.
Yeah.
There is a new norm, but we can't live our lives masked up for the rest of the. It's not.
For sure not.
We got to figure this out.
For sure not.
Can figure out how to disinfect it on counters. Humans better figure out how to disinfect it from my body.
One thing I do miss, though, that has definitely changed, and I had to learn to just deal with it and stick it out. We can no longer bring anybody, like no one can, because, okay, before COVID, if my husband was off, he would come with me to treatment, keep me company, talk, watch TV with me, whatever. You're just there by yourself now. Your husbands aren't allowed to go with wives. I've seen children who usually are there to keep their mom or dad company, like say goodbye. And the first 2 weeks, I kid you not, Cleela, was heartbreaking.
For you or for other people?
For other people. Because okay, for example, there is an old man that comes and his children will bring him. He has 3 kids. And so every time he comes a different child, they work it out and bring him. He was already so timid. He was very scared. And so his comfort was knowing that his kids was there with him. He had just started dialysis. And so he's getting used to it. And now the kids can't stay with him anymore. They're literally dropping him at the door and saying bye-bye. And you can just see on his face that he's like, I'm still not used to being here, much less being here by myself.
And that's a whole other kind of mindset.
Right.
So how does the hospital comfort patients when they're dealing with stuff like that?
And I want to be honest with you, I don't see them doing much.
Because they really can't.
No, because you have only a certain amount of nurses. There's no extra, like there used to be volunteers that come. They no longer are allowed to. So a lot of things, not towards me personally, but that I see within my dialysis facility that has changed.
Wow.
Yeah.
That's hard, Mama. That's
and honestly, I do what I can because I'm in the same area as him. I do what I can. So if I see that he needs a nurse, because he's not good at English. So if I see he needs something or he might be trying to talk, I do call somebody for him. But I mean, I'm on the machine too, so there's only so much I can do. Yeah.
Wow. Oh, I'm sorry. We got to figure. I mean, this is why the world. It's not just on the government.
Yeah.
You know.
Yeah.
It's on us as well. Like, you know, there's people that are trying to figure out how to help each other, and this is a perfect way to be like, make little pre-packages for people. And when they're sitting in dialysis, you've got a little pen, you've got a little puzzle book, or you've got a little something to take with you. But yeah, that's rough.
They have TV and stuff, right? But there's nothing better than what they know as company. Just someone that's there, even if you're not talking to me. Yeah.
If you look at everything, when a child is born, if they're having issues, what do? They put them on the mother. Yep. There's always something about physical human contact. Yep. And now with COVID, they like put that in there that it's messing with people's mind. I am
taken away just like that.
Wow. Yep. Okay. Wow. Oh man, that sucks. Okay. Well, for me, I can say that some of the things that have changed are I used to do a lot of treatment. That got shut. That got locked.
That got cut.
And I had to I was suffering. I was suffering so bad while they were trying to figure this out because like right now I'm happy I got my nerve block injections. I had to deal without them in the cold weather without months. I was moving slower. Things like my aqua therapy that was happening in the community shut down. Still hasn't come back. I had to literally go out north, out of the city, out of district, so that I could go out swimming in the lakes, clean lakes, because you know me. Crystal clear Caribbean-like water to get my aqua fit on, you know? Then there was training. We had to turn around and go into, I already had half of my gym belt. And so, but there were a lot of equipment that I still couldn't use. And so my trainer and me had to figure out, how to become Zoom training, right? And still get me to sweat.
Right.
It took until about May. It took about 3 to 4 months for my first clinician to be able to open their doors to start treating me again. So I sat down for months. I had to increase my pain tolerance pills, which really sucked because that added additional health issues to the side of things. And it was like, it became it, but at the same token, there were things like, okay, I'm not spending 2 hours going into treatment, but I can actually spend 2 hours trying to cook for myself because that's how long it takes me to chop up the vegetables and to cook the something and the whatever. So I actually started to try and start cooking again. I tried to start baking again. I tried to start, because the energy and the time was reallocated, but then it shut me down.
I'm sorry, I'm laughing because when you said baking again, with your hair how it is, I just put on an apron on you with like a little...
Aunt Jemima.
Oh my gosh.
I'm gonna have to take that picture for you one day. I am. Oh my gosh. Okay. One of the things that was really interesting, like we're talking about this, is essential services.
Oh God.
Because the government here is talking about what isn't and isn't essential services. And I don't know if our audience can tune into this or if they have any comments about this, but they're saying essential service is your family physician, but now your family physician can't touch you and they can only prescribe medicine.
Yeah.
But I need a chiro, a masseuse, and a physio to help touch my body for it to essentially move.
Okay.
And you shut that down and you're shutting it down again.
So all I have to say is at this point, make it make sense.
Oh.
No, because this is what I always have debates with people about. And I think people like me and you who know that physicians are essential, especially for people like us in this time, it just didn't make sense to me. I don't listen. The government must know what they're doing, but I don't get it. Things like, let's say LCBO and everything are open, reduced hours.
We must essentially make sure that you were intoxicated, not to deal with it.
Okay. But I need a doctor to do a checkup. And they ain't open. They ain't allowed to assess me properly.
I think what I'd like to do in this with right now, it's not just I don't want to just vent, but I want us to understand, like, if someone's watching this,
right?
We talked about effective communication a few episodes ago.
Yep.
This is where the government is only making, people can only make decisions based on the information that they know.
Yeah.
We talked about Black and in pain in our last episode, but we also understood that there were a lot of people of the Black racial culture that aren't advocating for themselves.
Yeah.
So now you've got a community, a worldwide community of sufferers, and I want to plead or challenge to you: how are you advocating for yourself? How are you out there saying, truthfully, while my family physician may load me up with drugs, my chiropractor who physically lines up my body, my masseuse who pushes away the knots, the physiotherapy that keeps me moving and surviving, these are the things that I need. And the only way that someone can keep it open is if we're talking about it, right?
Yep.
And so there's one thing about venting, which we've already done, but how are we going to tell our government, tell our officials,
yep,
this is essential? And it's not essential for 1 or 100 people.
Yeah.
This is essential because what are our numbers? Like 5% of Canadians deal with chronic pain.
Yeah.
That's the number, 5 to 7%.
Yeah.
It may actually be larger. And so we need to challenge. I want to challenge you guys. How you advocate, who you advocate for, how you're posting, who you're tagging, how you're getting out the information of what your needs are, because, you know, the Me Too movement didn't move until someone really stood up and went, this is wrong. The Black Lives Matter movement didn't come up until things were happening. This is the same movement that we as chronic pain sufferers need to start, and which is why we started our Fibro Fighters stand-up nonprofit.
Yep.
Right?
Definitely.
Those are my thoughts.
No, and 100%. I just think it does need to be more of a conversation, or even just a proper explanation, because maybe we don't understand. And maybe that's what we just need. And then we can say, oh, okay, then that makes sense. But right now, I don't think it's much explaining to us at all.
No, I think that we need to have our voices.
Yep, 100%.
Okay. So where are we moving on to next? Tell me.
So we're going to go into symptom similarities. Symptom similarities. Okay. Why are you laughing?
Go. Name the symptoms, and I'm just going to keep counting. Go.
Okay. So, first of all, we know COVID-19 is, people like say it's similar to the flu.
Okay.
I want to say yes, but not totally.
Okay.
We'll get into that.
Okay.
So, similarities would be like, you know, fever, you have a little dry cough, you're tired. Like I said, very similar to the flu.
Keep going.
Now, what about loss of movement?
Keep going. Keep going. You're not finished. Keep going.
Difficulty breathing and shortness of breath.
Keep going.
How about chest pain or pressure?
Keep going.
You got your achy joints.
Keep going. We're not finished.
Galila, continue since we're not finished.
Oh no, keep going. I'm counting. Keep
going. We have dehydration. We have lack of rest. There's like Kalila, seriously, she's still counting. You got 7.
Okay, so what? They go through the list, and there's like, when they first came out, I laughed. I swear to you, I laughed for like a good month.
Why did you laugh?
Because half to 3/4 of the symptoms associated with COVID-19 are associated also with chronic pain. And so as soon as I was like, oh God, is it COVID?
So it's funny you said that, because I had laughed at one point too, because when they were talking about like achy joints, they were talking about like, you know, tired. I said to my dad, I'm like, that sounds like an arthritis problem. And he started dying.
It started dying. Now that's why they use words like new symptoms or unexplained symptoms.
Yeah.
Because they'd be asking, and I was like, you know, I have fibro, right?
Right. Like it's like, yeah, but I always have that. Right.
And so when you would go on to, like, we're in Canada, if you go on to the COVID symptom, whatever, they're like, do you experience these things? And I was like, yes.
And
they're like, you need to quarantine. And I was like, for what?
I kid you not. Sometimes when I go to dialysis and I have like a pain in my foot, I try not to limp, because the first thing is like, you should go get tested. So I ain't limping. If I have a cough, I'm stifling it. Like, I ain't sniffling or nothing.
Well, I have alpha thalassemia, I have fibromyalgia, I have the PNES, I have all of these different things. And it was just really, really interesting because of the fact that, you know, again, they're learning. The whole world is learning. And I'm pretty sure a lot of chronic pain sufferers were like, there's way too many similarities for you. And so they had to reconsider it. But it is a very It was a thing that I have to admit, for the first 6 months or so, I was taking punch-in shots because I was afraid that as soon as I had an extra sore muscle, I was like, oh God, it's COVID. Take a punch-in shot, which is my COVID killer.
Yeah.
For those of you that don't know what that is like some serious overproof Trini rum that if you were to sniff it, it would clear up.
Like, you don't even have to digest it. Just smell it and it's in your system.
So when you take a small capful, whatever was down there,
it's out.
It's the Lysol for COVID.
Yeah, basically. One thing I do want to say on this, though, in doing some research, I saw that even after people are said to recover after COVID can, I'm not saying that it will, but it can bring an onset of chronic issues.
That was very interesting. I'm glad that you touched on that, because about 2 weeks ago, I saw a documentary where they're talking about called like elongated COVID or something. Is that what it's called?
Yes.
Elongated COVID.
Yeah.
Where you can be a year later, and even though you are showing up as non-systematic, your
organs are damaged from how severe the virus was. So it could be anywhere where you can get continuous brain fog. Your memory is no longer as intact as it was. You could be getting joint pains on a regular now. Your lungs can be damaged as well. Your heart, your cardiovascular, so your heart and your heart muscles. It can even be psychiatric. So depression and mental health sets in. And so that now is something you deal with after COVID. Maybe before you were okay. After COVID, it's now something you're dealing with. So there are chronic issues that can occur even after recovered, like you said, systematically.
And this is why we chose to do this conversation today. Because everyone's talking about COVID, but it affects us. It affects whoever already has chronic pain. And COVID is leaving people with chronic pain. We need to understand that, and we need to embrace everybody. And if someone's dealing or, has had COVID and they're having these symptoms, our community, our chronic pain conquerors community, they need to be able to embrace it and help people and just educate and keep
100%.
them right.
Yeah.
Did we find in any of your research coping or supporting ways, things that are out there throughout? I know we were looking into it, but okay.
So let's just go right into coping and support then.
Okay.
So many people, like we know, who contract COVID will be able to recover at home. So that includes getting enough rest. That includes staying well hydrated, taking medications to, relieve fever, aches, and pains. Very interesting enough, let me just say this. With the coronavirus declared as a public health emergency, providers are in fact able to prescribe controlled substances like opioids via telemedicine for people who go through severe pain. So that means one phone call and I got it.
I have actually got my meds. I get my meds prescribed every 90 days now.
Okay.
So I only have to go to the pharmacy once a quarter.
For that chunk of supply,
Chunk of supply.
Well, good and bad, depending. We know that there's still an opioid crisis out there, but it's available in that sense. Some people, due to the severity of the virus, are on ventilators to help with their breathing while they are recovering in hospital. So that's another way of how it's dealt with. Now, let's talk vaccines.
Well, what about that? Before we go there, I have a quick question. Are there resources available for people who already have chronic pain that, we're talking about being shut in, treatments being removed, and we want to be that resource for them or show them how to be resourceful.
Okay.
So what do we find?
So in doing my research, first and foremost, all our local governments do have things on websites to help pertaining to whether it be mental health during COVID, whether it be, getting your kids back into school or dealing with your school at home, different aids that are available for people who used to have in-home support, what the changes are, how to go about the different changes, or whatever the case is. I found that British Columbia has amazing supports and resources. So they have a pain support line.
Yeah.
Well, it remains open, or you can even just email and someone gets right back to you. They have a coaching for health, which is a telephone based service as well. Yep.
That's good.
They have a webinar on anxiety and pain as well. So it teaches you how to cope with anxiety and pain during COVID-19, and it's an actual psychologist that discusses these things.
So I heard that there are financial support here in Canada.
Yes, there is.
Are giving payments to Canadians with disabilities and things like that.
Right. So it's a one-time payment.
Yeah.
And so there's also temporary additional supports for disability assistance. There's also people with low income. So they have even low income seniors. They have stuff available for them.
Wow.
But I think it's all really a matter of because every government's different. What we're doing here in Ontario is different from what they're doing in BC versus Alberta and all that stuff. So I want to say there is a lot out there. I have seen it out there. It's just for you personally to go on your local government to see what is offered to you.
So people, please don't sit there and don't think that things aren't out there. Yeah. They are, but you also again have to advocate and be resourceful.
Yeah.
Find out what's out there. Don't expect people just to give you this information. There's so much chaos. Mm-hmm. You gotta be resourceful for yourself.
And it helps. Even if you find it and someone wants to say nope, you bring them that information and say, this is where I found it from. What is it? Because let's just face it, COVID is stressful. No one wants to deal with anybody right now because of how hectic it is.
Yeah.
But we can't stress enough to advocate and do some of the work for yourself.
So point on this before we go into vaccination, because we're almost ending up.
Yeah.
So we're talking about me going to Cali. I had to go to my doctors and request, because they're not just letting anybody over the borders. I went to my doctors. I gave them a draft out. I called the U.S. border, found out what I needed. I got my accommodation. I got letters from my doctors to show why I needed support going over, why I was going. Right. I got confirmation from my appointments in the States to say, this is treatment that can only be done in the U.S. This is why she's crossing.
Right.
So, like, the fact that I had to sit down and pre-write a draft letter so that they understood, because they don't know what to do. You may have to do that kind of stuff yourself.
Yeah.
Okay. Do we want to go into vaccinations really quickly?
I mean, why not?
Go on. Let's go, girl.
Let's go. Okay. So for the most part, we know vaccines are rolling out.
Okay.
It's all over the news. Everywhere we look, it's there. Almost 3 million vaccines have been administered in Canada already. Okay.
Yeah.
It is asked that we help stop the spread of COVID-19 and get vaccinated. And of course, when considering the vaccine, don't be afraid to consult your physician and educate yourself before making a decision.
Question.
Yeah.
Did you know that there are 6 companies that are producing the COVID-19 vaccination right now?
Listen.
Yes.
I want to know, do you think there'll be more? This is just like the first year, call it. Do you think there'll be more than 6?
I don't know, but what I do know is that in there being, when we put the question of the week out, which we're going into next, one of the things that our chronic pain community is cautious of is which vaccination they get because of health concerns.
Yeah.
You can't just go in and say, vaccinate me.
Yeah.
You need to be, if you have health concerns, you have to go and say, these are my issues.
Yep.
Which is the best vaccination if you're choosing to be vaccinated?
Yes.
Are you getting vaccinated?
Okay, so with the vaccine, although they're heavily rolling out, there's still unsurety that one can still contract the virus.
Mm-hmm.
I'm going to be honest.
Mm-hmm.
I could, and I actually just told my husband this, I could be getting vaccinated as early as tomorrow.
Why?
Yeah. So I thought about this, and there was a couple of things. I did consult my physician, and there was also a couple of things that I had put into perspective. Number one, it sounds simple, but I just feel like we're going to have to get vaccinated to hop on a plane, and ain't nothing stopping me from flying around the world. Wait.
I'm listening.
What another thing though, I am waiting to get a kidney, and I was just thinking, what if that's also something that I would have to consider at the time of going for surgery? And I don't want to make that.
Have you actually asked?
I have asked, and that's the thing. They're not so sure where things are going with that.
Okay.
So that was something to consider as well.
Okay.
I don't know.
All right. Well, I am a strong no.
Yeah.
And I'm a strong no because I haven't gotten the flu shot in over 2 years.
Right.
Because my clinical team has been working with me through the winters.
Right.
I know that this is a different kind of influenza, and I have health issues. But I already have enough crap going into my body with all this medication.
Yeah.
And the vaccination, I'm not in the mood for it.
Right.
I can't afford to really think about what the side effects might be and how that's going to affect my body. And so for me, it's a hard no, especially like I think you mentioned that even if you get the vaccination, it's not to say you still won't get COVID again.
COVID, yeah.
So why are you going to give me the vaccination
if you're not sure?
But that's my thoughts.
Yeah, and everyone has their own opinion, is entitled to their own opinion. I don't know.
Let's find out what other people's opinion were.
I mean, okay, so we have something from Melody Wolf.
Yes.
She said, I think it's great you're discussing the vaccine. I personally haven't made up my mind yet. So another person who is unsure, and that's fine.
I've gotten a lot of people that have said, Nancy said, I've taken my first shot. I have some soreness to the touch of my muscles, a little hard to flip my arm. And I had a fever for a couple of days, but that was well. I'm getting ready for my second one. I have heard it's been such a 50-50 battle between yes, definitely, no, or I've already gotten it. Or just be careful about which one you're getting. It's so across the board.
Yeah.
And what I do want to see though is I don't want to see it forced upon people. And I do unfortunately feel like healthcare workers aren't getting the option. They're getting really pushed to get it.
Right. To set that example.
Well, I just want them to give people the free will to do it.
I do want to say I was like you, heavily like, no, I will not be running to take it. But I will say one thing that helped my potential decision is that I did ask questions. I did email my doctor and I said, I need to speak to you in regards to vaccine. And he actually made time to come to the clinic that morning. And he's amazing. You all will get to know who he is when we discuss National Doctors Day, but he took the time to explain and give me the stats, and he didn't force me, but because he understands that I have lupus, I do dialysis, so he was able to guide me in when making that decision. But he did let me know, listen, it's up to you. It's not going to be forced. You don't have to. So again, guys, that's why you do your research. You ask your questions no matter how much it is, and then you can make a proper decision.
Wow. Okay. So can we go into our keep it moving moment because we're talking about all of this?
Yes, we can.
Okay. So basically, here's the thing. Our keep it moving moment says this. Life keeps throwing me stones. And I keep finding the diamonds. This is from an Anna Claudia Antunes. And I think that this is really important with our conversation right now. Mm-hmm. Life keeps throwing me stones. That's the key word. And I keep finding the diamonds.
Yeah.
There are still diamonds in the midst of all of these stones.
Yep.
And I really hope that our chronic pain people are honestly out there and having these conversations, or at least, not just seeing the hardship. And I don't want to say make lemonade out of lemons, like I'm not that person, but I do like this thought in terms of there's stones, but I find the diamonds.
Yep.
That's what's really important for me.
Yep. 100%.
Yeah. Okay. So is this it? Are we done?
Yeah, but let's wrap it up with some final thoughts. Kalila, what are your thoughts?
Okay, people, COVID is hard. We don't have the answer. Yep. We don't know when it's going to end.
Yep.
But you still have the breath of life in you. You still have the ability to live a life.
Yeah.
You still have the ability to social distance and keep yourself healthy in the midst of this.
100%.
Find ways to smile. Find ways to live. Find ways to love. Find ways to laugh. Find the diamonds in the stones.
I love that. We know COVID has changed the world drastically. Drastically. But along with what Kalila said, let's continue to please follow the health guidelines, all the protocols we take with washing our hands, wiping down surfaces, wearing our masks properly, guys. Please, let's do what we can together so that we can help stop the spread of COVID-19.
Okay. Well, guys, that is it. I'm Kalila Brucewell, the Overcomer.
And I'm Sharifa McLaren Thomas from YouTube, The Thomas Life.
We want to thank you for joining us for another episode of Chronic Pain Conversations. We will be back next week, Tuesday at 12 p.m. Eastern Standard Time to discuss sleep apnea. I'm really excited about this because this is something I've gone through. We also want to say be sure to follow us on Facebook and on YouTube and on Instagram at CP Conversations. And if you are a chronic pain sufferer who would like to share your story, we invite you to be our guest and to visit our bio link on any of our social media platforms. We already have some guests that have signed up, and we can't wait to bring them on into our next season, which is going to be starting really soon. So we just want to say, have a blessed day. And remember, Chronic Pain Conversations is the show that enlightens and advocates about chronic pain. We hope you have a blessed week, and we will see you. Take care. Bye.